I am born and raised in Baton Rouge. I literally grew up down the street. Went to St. James for elementary school, and then I ended up at Episcopal and graduated. And then from there, all my friends were going to LSU, and so I decided to split off and branch out, and I went to SMU in Dallas. And from there, I stayed there for a little bit, and I was unsure if I was gonna do pre-med or my whole family is doctors, so I resisted it for a really long time, but finally I fell back into it, and I ended up at Tulane in New Orleans. My first year of medical school there was the year Katrina hit. And so from there we got knocked out and went to Houston, and I stayed there for a year, and then obviously we went back to New Orleans and helped kind of get back the hospitals, and University Hospital was a big training area because Charity was shut down. So anyway, graduated from there and matched into internal medicine at Earl K. Long. And so Earl K. Long has also been through some changes, so I was there for 2 years, and we saw everything from prisoners to, anything. So everyone comes in and they're like, I haven't shaved my legs. And so I was like, you don't understand, I've seen it all. So it was a great training opportunity, and then when Earl K. Long shut down, the LSU residency program moved to Our Lady of the Lake. And so from there, that's where I graduated from. And then this is my first start out as, in private practice. And so it's all been good so far. Well, I have a 4-year-old daughter, and so she takes up a lot of my time. So I'm doing a lot of kid movie watching, taking her to all kind of events throughout the city. But I love LSU football. I am at every LSU football game and a diehard LSU fan. I love to cook. So I spend way too much money at Whole Foods all the time and getting groceries. And just hang out with friends. We have a lot of my girlfriends from high school. We have a dinner club. We do that. We go out to restaurants. I'm just pretty normal. I'm pretty boring, honestly. But anyway, it's good. So I'm happy to be back in Baton Rouge, though. I think I'll be here forever. Internal medicine was something where I felt like I could delve into a lot of different problems and kind of treat the patient as a whole instead of pinpointing one little thing. And so being able to talk to them, it's not only about their medical problems, but a lot of times you're kind of a social counselor too. But treating underlying things and treating the person as a whole is basically why I did internal medicine. It's so convenient for me as a primary care physician because I have not only other physicians in my specialty that if I have a question I can refer to them, but for patients that need routine health maintenance, things like colonoscopies or problems which are beyond my scope, it's easy to even get them a same-day appointment. They can walk up downstairs from me and go see dermatology, they can go see urology, I can refer them to surgery, and it's all within the clinic. Same thing with the labs, they're all within the clinic and they're synonymous on our computer system. So everybody can really see everything. There's a lot of access. I find that if you need an appointment, physicians here are so willing to see your patient if you really prompt them to, and it's just the convenience sake is really, really great.